Thank you. Thank you very much for a kind introduction. I'm a very great honor to have an opportunity to present this topic in this meeting. Actually, this topic was presented 1 year ago in the KATSO meeting, and it was a Korean lecture, but today I will do the same presentation in English version. And this topic is about the multi-center database study performed around 5 or 10 years ago in our country. But actually, the pioneer of the multi-center study in our country is Professor John. Professor Sang-Hoon John did a lot of multi-center trial and inspired us how to do the multi-center work. I really respect Professor John. But this is a more recent one, so it is why I'm now presenting this kinds of work. It's called as a work of KAT, Korean Association on the Research on Thymic Disease. So I will start my talk. We always do some kinds of presentation in the academic meeting and publish our paper in the very famous journals. This is why we are doing. It is because we want to generate a new knowledge. Making new knowledge is a very important driver to improving the quality of society and improving to the more advanced status of humankind. So this is a very important thing. This diagram shows a typical way how to make or generate a new knowledge. There is some kinds of the issue, problem, and a pioneer do work to propose a new solution. But somebody agrees, but somebody do not agree with that. Eventually, generalization is necessary to make a confirmation and consensus. So multi-center database study is necessary. That after getting some kind of outcome, we can apply the outcome to the real world. And eventually, the goal of the whole work on this issue is improving the patient outcome. So we're making a new knowledge is directly related to the improvement of modern medicine. And this is one of the very recent innovation, which was made 15 years ago, when Steve Jobs introduced iPhone in the world. And at the time, in 2007, some people is chilled about their outcomes. It is a very new innovation, but some persons, especially in Asia, was very skeptical. It is just a toy. But however, 15 years later, this becomes the standard of our daily activity. These kinds of devices change the whole world and change the whole daily activity of the human being. This is one of the very important innovation. But however, most of the thing does not go like this one. Rather, this kind of work is more popular in the generation of knowledge. The open and large-scale collaboration usually makes the very solid consensus, a solid knowledge for more in the academic field. The first example is Wikipedia. And before the Wikipedia, Britannica was the standard of encyclopedia. Britannica was made by the very world-renowned expert in some kinds of academic field. But after making an open, large, global scale collaboration using the core of the many donation of knowledge, Wikipedia is now become a global standard in the encyclopedia and searching some kind of knowledge. The other example is R project. R project is a collaboration in the statistical method. Before introduction of R project, we used very, very expensive statistical software with very limited function. But after introducing the R project, the software becomes free, and so many diverse software, the statistical methods can be utilized by the public. This is a very big innovation. Using why collaboration and the support of the many people is necessary in the academic field. So, in my opinion, I think the multi-center study is also essential, like as other academic field, to generalization. Sometimes we can make a new knowledge, very pioneering innovations in the knowledge, but usually a generalization makes the confirmation and makes the consensus to follow everybody else. And in terms of the generalization, and we, Korean group, started to do a national database study in the thymic disease. It started in the year of 2013. It started in the WCLC meeting in Sydney. Professor Dong-Kwan Kim was there as a proposed some kinds of database study, and me and two people started to do some kinds of work. And we gathered some of the active members from four hospitals in our country: Asan Medical Center, Seoul National University Hospital, and Samsung Medical Center, and Yonsei University Severance Hospital, and joined the database study and make some kinds of database. And after that, we published our outcomes in the many other journals. Our database is actually was based on the epithelial database. However, it is quite different from epithelial because the epithelial database was already made 10 years ago, so it was quite a little bit old. We revised the database format and we added something, especially for the operation part and the pathology part. We renewed this database, and so our database has a strong point in the operations viewpoint. And after making a database, we published several papers. Totally, and 8 papers has been published in the international journals. And this paper is the paper published recently. This is a paper about the whole database, including the 1,300 of thymic epithelial tumors. And the reason why this was published is that I wanted to make a history recording for our work. After 10 years later, probably young generation may not remember our work, so I want to make a record for this whole work. So I asked to Asan Medical Center to write some kind of whole database paper, and they did a very excellent work on this kinds of work. This is a most representative paper. And next I will introduce some of the promising result of our database. The first one is this one. This paper was published in Lung Cancer Journal, and in this paper we compared the total thymectomy and the limited thymectomy, and reported there was no difference in suboval survival and recurrence-free survival. This is not a first paper in this issue. Already Japanese group JAT already reported the same finding several years ago, but this is maybe a second paper on that issue. So after several series of the comparing the total and limited thymectomy, currently many surgeons in the world are utilizing limited thymectomy than the total thymectomy. And this is a second important paper. It's written by our hospital. And the other issue we want to know is there any role in the mediastinal lymph node dissection in thymic epithelial tumor? And we selected some of the patients who received the lymph node dissection, and we compared them to other control groups. So conclusion of this paper is that although lymph node dissection can accurately predict the prognosis, but the survival benefit was not identified. So currently the role of lymph node dissection is questionable on the treatment value. So this is one of the very representative paper on this issue, because at that time this is the largest volume, and this has a very accurate staging policy, and so outcome was so beautiful. So I think this is also important work in our database study. The other important study is this one. This one is written from the Asan Medical Center, and they identified the significant role of the size, and they compared their outcomes, the prognostic outcome between large size and small size thymic tumor, and they suggested around the 5.5 centimeter would be the diagnostic criteria for the differentiate large size and small size tumor, and suggested their size should be included in the staging system. This is also not the first suggestion. The first suggestion was made by the Japanese group. This is the second suggestion in this field. And because several groups proposed some new staging system, this year epithelial suggests a new next coming 9th edition of TNM staging. Because of our work and Japanese group's work, they eventually changes to the staging according to the size. They divide this T1 into T1A and T1B by dividing by the line size of 5 centimeter. So because in this analysis, our CAT group devoted so many cases of the database. And the most largest one is the Japanese group. However, the post largest group is our Korean group. So we contributed something to make a new staging system in the epithelial. However, although we did lots of work on the issues on the thymic disease, however, there are still many unsolved problems. What is the effect of the total thymectomy and limited thymectomy? We still don't know. And the role of lymph node dissection. What happens if we follow the strict epithelial guideline for the staging and mapping the lymph node station? But most of the retrospective data was very heterogeneous. The other one is a systemic treatment. We don't have any effective systemic treatment in thymic disease. The last one is a marginally resectable patient. Should we operate or not? It's still unclear issues. All of the issues should be readdressed using the more recent database. This is one of the examples which we ignored for a long time. Recently, NEJM, this paper was published from MGH. They compared 1,400 patients who received the thymectomy versus 6,000 controlled who did other thoracic surgery. And after around 20 years of follow-up, they concluded that the total thymectomy increased long-term mortality, and the total thymectomy increased autoimmune disease. And the immunologic profile, T-cell count, and the inflammatory cytokine level was abnormal in the total thymectomy group. Yes, we suspected probably if we remove the whole thymus, there may be some change. But everybody in this room ignored for a long time. But at last, it became in front of our research topic. So, to answer this question, I think it is a time to initiate a randomized control trial. This is a trial we started recently in our hospital, comparing total thymectomy versus thymomectomy. So the name of the abbreviation of name of the TVT trial. We are going to do a randomized control trial comparing total thymectomy and thymomectomy. We include in the patients with stage 1 thymoma without myasthenia gravis. So we are going to enroll 400 patients in this field. And outcome measurement is the first phase 1 will compare the early outcome, and the phase 2 will compare the immunology outcome. In the last stages, we are going to compare the long-term recurrence pattern. So I want to suggest to you, this is driven by my hospital I want to suggest to open this study to the multi-center trial organized by our society, KATSO. Maybe this is maybe a first step to revise the KAT program and to make certain kinds of the interdisciplinary collaboration in our society. And the last topic I want to say is that we are facing the new era, because in the first part of my presentation, I talked to you there's a way how the new information are generated. But currently, the many things are being changed. Currently, new type of knowledge generation are now being made by AI. This is a very typical type of the AI and ChatGPT. For example, I asked to the ChatGPT 3.5, what is the long-term outcomes of total thymectomy? This the ChatGPT 3.5 was made by the just 2021 database, not current one. It's old database, made by old database. But the answer was straightforward. Yes, myasthenia gravis management is important. Thymic tumor control is also important. But the total thymectomy induce the immune function abnormality and increase the autoimmune disease. And quality of life, overall health may be dependent on the patient status. ChatGPT already knows the outcomes of NEJM study 3 years ago. So, but everybody ignored that. So this is a very new way to make a new analysis. We must do something now. So it's my idea. What will be the next step using the AI? So if we developed AI using our database, huge big data, we can sometimes in the near future, we can ask it to the AI that there were a gentleman, the patient who has a T4 or something and the B3 thymic tumor. Should I operate it? Or what is the best multimodality treatment? Then AI can answer to that. But currently, we ask this question to ChatGPT. The answer is very unclear. Please meet your doctor. Is the answer. But we can make a very disease-specific AI program. We can use this one to make a new generation. Furthermore, if the patient has a complication after operation, we can ask the AI, what is the best way? What I should do? What is the diagnosis? It can be another solution to improve our patient's care. So this is my presentation. I think that I must conclude my presentation, and I think innovation and collaboration is the most important way to make a new analysis in modern medicine. And collaboration requires voluntary participation and dedication. We can remember the situation of the KATSO database work. And I think the main focus on the next step research will be the big data and AI. And we should prepare the future changes that are coming soon. Thank you for your attention.
Thank you for your nice presentation. Questions are open to the floor. Any questions or comments?